Um, well, welcome everyone. It's great for you to come. Glad you could make it. This is part 2 of our PHIPA series, um, and this is managing PHIPA breaches, kind of essential steps for healthcare. So we're going to try and get into some of the details around PHIPA. And again, I'm William. I will be the moderator. So if you have questions, you'll see on the right, there's a tab. Actually, it's up top if you don't click it. Q&A. So if you do have any questions at any point, um, please put them in. What I've found from webinars and things like this is that if you have a question, probably the same, someone else has the same question as well. So you'll be doing us a favor by helping us clear that up. So please do feel free to use that, and I will interject, and we can get John to answer that question. And yeah, John is going to be doing the main portion of the talking. He's our network admin, and he has a great deal of experience in cybersecurity and IT at large. So yeah, without any further ado, I think we'll get right into it. So again, please use the questions. If you have any, that would make my day. So take it away, John.
All right. As Will said, I'm John. I'm systems administrator here, focused on cybersecurity. Um, I'm just going to reiterate what Will said last time. After part 1 of this series, we had quite a few people who wanted to have calls with us to discuss, like how it applies and like different little technical questions around PIPA. So I would say probably 50% of the questions were the same question across people. So it's not a bad idea to just pop them in, and that way you don't have to waste time for potentially an hour on a phone with us, if it's just a simple question, right? So anyway, it is a lot of material, so I'm going to go quickly, but I just want to, re point out there that questions are encouraged, so feel free to stop me. I can speed up or slow down as necessary. So, quick recap. What is PIPA? So, Personal Health and Information Protection Act of 2004. It governs all the information around how PHI, so personal health information, must be collected, used, disclosed, protected, whatever. The other thing is that it requires breach notifications, what your responsibilities are, whose responsibilities are what, and it applies to long-term care homes. I'm sure that this was just a mistake, but there was a particular vendor that's big in the long-term care um, field that in an email, so like it is written, it said that PIPA does not apply to long-term care. So I just wanted to reiterate, it 100% does. I've checked with legal teams on this. I know for sure it does. So, it's important that you take that information and run with it. So, um, so let's now say, what is PHI? Because the way you decide whether or not PIPA applies to you is whether or not you have any PHI, so personal health information. So, what is PHI? So if you have sorry, my slides are over on the one screen, so you'll see me going back and forth. The PHI is name, address, telephone number, if tied to health records. That doesn't necessarily mean it is a medical history or things like that. A health card number is considered PHI. Test results, PHI. Mental health information is PHI. Even billing info, if it's related to anything to do with health services, is PHI. So if, let's say, you work in the billing department of a long-term care facility, the billing information for those residents is PHI. So it's still governed by the same legislation. So health service provisions, so like who saw the patient, what services were provided, those kind of things, and appointment letters, referrals, any of that kind of stuff. So PHI is tons of stuff. It's all over the place. So it's really important that you treat everything as if it is protected. So next. So why should we be focusing on the breaches then? So it's not just an IT thing, it is a legal emergency under PIPA. So they must be responded to immediately, and delay can really increase your liability. So as with the last presentation, all the notes and references to where it says these things in the act is in the notes of the presentation. I apologize in advance. This one is really, really heavy in notes. So you're going to want to go through, because it's going to be impossible for me to go through, like read off all the references and stuff for you as we're going. So that's why you should be focusing, because it requires immediate action, and there's very specific actions that are detailed in the act. Breaches huge financial liability, as we discussed in part one, and you need to have a very specific way of reading out these breaches. So announcing the breaches. So now the question is, what is a breach? So any unauthorized collection, use, or disclosure of PHI, access without a legitimate need, which is known as snooping, lost or stolen devices that contain PHI, ransomware attack affecting PHI availability or confidentiality. That's the other thing, is that although those are much less likely, like the vast majority of the breaches that you're going to be dealing with are those first three. Ransomware, huge problem, but that is not what you're going to see the majority of the time. The vast majority of the time are going to be the other three. And the important thing before we jump into the others is intent doesn't matter. It doesn't matter whether or not you had the intention of protecting it. The point is, if it wasn't protected, it's a breach, right? So access without a legitimate need. So that would be, you're curious about I like using the word patient, because in long-term care they're typically residents, but I call them patients anyway. Let's say you're curious about something to do with somebody on the second floor of your home. They're not somebody that falls under your work, so you have no real need to go look at their file. If you go look at their file, that's a breach. So that needs to be documented, that is a breach. A lost or stolen device that contains PHI. So if you use note-taking devices, like I've seen doctors walk around with like little recorders, and then they record their notes as they're walking around, and like they dictate it, and then somebody types it out later. If he loses that, that is a huge PHI breach, because that is a lost or stolen device that contains private health information. It could also be, like laptops, phones, tablets, things like that, because as we denoted earlier, what is PHI? It's pretty well anything. So the moment you put somebody's name and it's related to health, well, if it's a device that belongs to a long-term care facility and there's a name on it, we know that that person is a resident or likely to be a resident of that home. So that would be a breach. So a ransomware attack, the biggest issue with ransomware these days is not necessarily like what it used to be, is that they would get on your system and then they would encrypt everything and they'd say, give me money in order to get your data back. And now what they're doing is they get on your system, they exfiltrate that data, meaning they download it to their systems, and then they ransom back to you and say, hey, unless you want this data released on the dark web, you need to pay us. The problem with that is that there's no guarantee they're not going to release it anyway, or they're not going to come back to you in 2 months, 6 months, whatever. So prevention is key. But yeah, anyway. All right, so let's jump on to the next one. So what are the most common causes of breaches? Really, the most common cause is human error. So we discussed what is a breach. A good example of a breach that is very common is, I'm not picking on nurses, but nurses tend to use the computers a lot more than a PSW does. But we'll say a nurse prints off some kind of care plan, and then accidentally prints it to the wrong printer, and then can't find that paper. They're walking all over the home trying to figure out what printer it's at, and they finally find it. But if it's been there for a few hours or they never find that paper, that's a breach. So that needs to be logged, right? So the next thing would be like weak access controls. This is not necessarily something that would be something that most of the people watching this can resolve themselves, but it is something that you are responsible for. So it's important that you're checking with your IT department to make sure that they have access controls in place that prevent somebody from looking at stuff that they don't need to be looking at, right? So, that access control falls under staff snooping. There's really, unless your staff float around between every floor, let's say you have 3 floors on your home, most of the time, most of your staff are going to work on a particular unit, and that's usually where they are, unless they pick up shifts on another unit or something, right? And that's fine. People that are floaters, you can give them access to multiple units, but the people who are always on that one unit, there's no reason for them to have access to another unit. So give them access to only the unit that they work in, and that's it, right? That's a good access control. A weak access control is, well, we give all of our staff access to all of the residents just in case they need to do something. Just in case is not a valid reason to give somebody access. So you should have processes in place to be able to quickly and efficiently provide access and take away access as needed, right? So lost or stolen devices, like we already discussed that. It could be things like a USB stick. They're the bane of my existence. I highly recommend that they are banned in every facility. There's no reason for a USB stick to be used. And I hear all kinds of reasons. Oh, but I need to be able to take this home to work on it. Like, you do not. You do not need to take it home to work on it. You do not need to take it and put it on another computer, because you should have either a file server or SharePoint or some kind of file sharing system. There is no reason for a USB stick, because they are a massive source of liability. So the other thing would be a laptop containing unencrypted resident health records. So if it's stolen from a staff's car, that's super common, by the way. If you leave your laptop in a car, people will just break the window and take the laptop. Most of those people are selling it to a pawn shop. They're not particularly interested in the PHI, but it still counts as a breach. So it doesn't matter if it's intentional, not intentional. Notification obligations are now triggered, right? So misdirected, we had discussed, like, if you had printed to the wrong printer, could also be something like, oh, well, I faxed pharmacy And then you go and you look at the log and no, you were off by one number. So you didn't fax pharmacy, you faxed somebody else. Well, that's a breach. So you need to disclose that that is a breach. So the other thing that's really important too is that even if the data is retrieved afterwards and the breach is remediated, you still need to disclose that breach, right? So let's say you deal with two pharmacies and you send that patient's data to the wrong pharmacy, and the pharmacy emails back and says, hey, this isn't our patient, this is for another pharmacy, we've deleted the record, so we don't have the record anymore. Doesn't matter, that's a breach. You need to document and you need to disclose. So we discussed cyber attacks. The other thing that's really common is, most healthcare professionals are in this industry because they want to help people, right? So when a staff member is talking to our resident's family and they haven't looked at who the POA is, they just start talking to the family, and maybe it's the daughter or the son or whoever, and they're asking questions about their parent. Just because they're the child doesn't mean that they are authorized to have that data. So you can't discuss that with somebody that isn't authorized to receive that data. That sounds obvious, but it happens very often because they think, well, it's family, but there might be something in that patient's file that says that they're not allowed to be discussing with that particular family member or whatever it might be. Not an expert on these things. As I repeatedly said during part one, I'm IT, cybersecurity is my thing. So I encourage you to speak with legal around the actual legal consequences of these and what can and cannot be disclosed in certain situations, etc. But that's a good example of a breach. So if there's a breach of any kind, you have to log it and you have to report it. The other thing that I've personally witnessed is a staff member verbally discussing another resident's um, diagnosis within earshot of visitors, like in a cafeteria, for example, in this situation. Like I was walking through the cafeteria to do something, and I overheard staff talking about a resident's diagnosis. That's a breach. I am not authorized to hear that information. I have access to everything if I really wanted to go look, but it doesn't mean that I should have access to it, right? There's no reason for me to know that, so I shouldn't know it, right? And just I have another example written here. A printed discharge summary, for example. If you leave that left unattended at like a nursing station or in a common area or something, that also counts as a breach. It's just one of my notes that I had written there. You get those little brain moments. Improper disposal of records, that's also super common. So, you've got shredding bins in most organizations. If a paper chart is found completely intact, just in the general garbage or sitting on top of the shredding bin, like, no, it needs to be in the bin. So that needs to be dealt with. The other thing that I feel like a lot of organizations don't realize is they get rid of old computers and they don't do anything about the data on those computers. And even if you have all these processes and policies that data shouldn't be stored on individual computers, it should be on the server or the file share, whatever it is, doesn't matter. Users very rarely actually listen to policies and procedures. So there's inevitably one or two records at a minimum on that device. So what I always recommend is, and what we do for our clients is we pull the drive out of it, we crush the drive, and then the rest of the computer can go to recycling. That's fine. But you need to have a end of life process for dealing with that data. So it gets shredded if it's paper, it gets destroyed if it's on digital. The other thing is by third-party contractors. So for example, at Brock IT, we have healthcare clients, and we shouldn't really have access um, to data without signing privacy agreements. So with our clients, for example, we have non-disclosure agreements. So you should be going through and checking with any of those vendors to make sure that they have non-disclosure agreements, right? And really anybody that's working inside the home, even if it's like cleaning staff or whatever, they should all have non-disclosure agreements. So, and it's also important under Section 17 with PIPA that anybody that acts as an agent on behalf of the custodian must be trained and bound by privacy obligations. So it's it's Brock IT is covered under that too. Like we're going to have all the same legislative requirements, right? All right, let's jump to the next one. Trying to be cognizant of time here. All right, so what are the immediate actions then? So first step, contain the breach. Second, notify internal resources. Third, preserve the evidence, very important. Fourth, assess what the scope and impact is. And then fifth, notify the affected individuals, determine if the IPC notification is required, and mitigate, right? Now, there's going to be a little bit of overlap there because you're going to have to have a mitigation strategy in place before you actually notify the IPC. But let's start from the top there. So contain the breach. So if you have unauthorized access, stop it immediately. Retrieve or secure any exposed information. So paper records, stolen devices, leaked emails. Figure out what exactly was sent out and retrieve that data. Get as much of it back as you can. Disable all the accounts that might have had system access. It's in the event of a breach. I'm a big fan of a scalpel in security, but in the event of a breach, there's nothing wrong with a chainsaw. You just shut everything down. Anybody that might have even the slightest bit of possibility that they were part of the breach, shut them down. And then go through account by account and enable back the ones that you're sure are good, right? But the first step is contain. Sledgehammer for the contain is totally fine. You can switch to finishing nails later. So the next thing is notify the internal authorities. So you have a privacy officer or like a designated breach response lead. So they should be notified immediately. Once that has been done, now we can go on to the next step. So the next step is preserve the evidence. So save all the audit logs, emails, access logs, device tracking information. So for example, if you had like PCC, you'd have to reach out to PCC and say, hey, is this user account, W Thompson, and we need to know everything that W Thompson looked at over the last 96 hours. And we need a full audit report for that user account. And that's where you start. Then you have to reach out IT and say, okay, I need to know everything from their device, everything from their access logs on the server, everything, all of those things need to be figured out. Then you need to isolate the compromised devices. It's important that if there's a compromised device, like, so this is in the situation of malware, you isolate them by unplugging the network. Don't turn them off, leave them on, because there's forensic evidence that we need as cybersecurity professionals that disappears when you turn it off. So leave it on and let your IT department go to those devices. The other thing that's really beneficial is that if you just unplug the network cable from a computer, it's not going to kill the computer. So it's not like you're doing any long-term damage. Just unplug it and let it sit there until your IT says it's good. So, let's say it's, I'm going to pick on Will. it's Will's account that was breached, so we're gonna assume that his device is compromised, right? So we're gonna take Will's. But you know what? Tracy's office is right across the hall from Will, so we're gonna say, well, just in case it was physical access, like somebody went into Will's office and accessed it that way, let's maybe grab Tracy's as well. So I'm gonna unplug Tracy's, right? So the next thing is document everything immediately. So who discovered the breach? When did they discover it? How did they discover it? All that stuff needs to be documented. So next thing is assess the scope and impact. So again, like I said, this is where there's like a little bit of overlap between the areas. So you're going to kind of be doing a lot of these things at the same time. So assess the scope and impact, what information was involved, type, volume, information, sensitivity, and then whose information was involved. So residents, families, staff, how long was it exposed? Um, who accessed it? Was it internal staff, an external third party, whatever? Um, and then on top of that, you need to be having statements from your employees to be part of this words struggling here. Will, help me out. What's the word? Investigation. Thank you.
Yep. Sorry, I was like, I don't know where you're going with that.
Yeah. I am still on my first coffee. So now the next step is to notify affected individuals. So HIPAA says that you must notify at the first reasonable opportunity. Now, first reasonable opportunity can mean a lot of things to a lot of people. So as usual, check with legal. But I can tell you that the notification must include what happened and what information was involved and advice to minimize harm. We're going to go through that more detail later, but you need to notify the affected individuals as soon as reasonably possible. That doesn't mean the moment it happens. That means reasonably possible. So you need to do your investigation and figure it out, right? You can't just be sending stuff off half-cocked willy-nilly. So determine if IPC notification is required. So the way you determine that basically is the breach part of a pattern? Did staff disciplinary action occur? Is there a significant number of individuals affected, or is the data significant in its sensitivity, right? So those are the basics. Again, we'll go over it more in detail later. Next is mitigate. So what are your short-term fixes and your long-term fixes? So as part of the IPC guidance on preventative measures, there's, again, all of this is referenced. Short term, like force password resets, increase the monitoring, pull the logs. Like we're going to have maybe more detailed monitoring of log files for the next 6 months, whatever that plan is. And then long term is, update policies, add encryption, retrain staff. Like all those things need to be in there and part of your plan and action. So, all right. So notification requirements. So affected individuals, it's mandatory for any theft, loss, unauthorized use, or disclosure of their PHI. Even minor breaches must notify individuals. It's really important that you that you understand what even a minor breach is, because way back at the beginning of this presentation, we said that even something as simple as their records being left in a printer all day, all night, and then you find it in the morning, that's a breach. Like you don't know who was in that room overnight. That's a breach. You haven't monitored that data, and that data has been sitting there unprotected on a printer overnight. That's a breach. So IPC, it's only mandatory for serious breaches. So we're going to discuss that on the next slide. And and you must submit a formal breach report to the IPC. So there is a breach report. There's a link in this presentation, so you can go to their thing and you can read through what the report looks like. And then, of course, you've got regulatory colleges. So this is required if there's like professional misconduct, for example. I don't know what that means specifically. That's not my realm. But you need to notify the applicable college, so like the College of Nurses, for example. Institutional leadership, that's always internally escalate to the administrator, privacy officer, director of care, whoever it is that's in your organization. That's the person that it should be. Every single minor breach should go to. And then they're the ones that take the notifications from that point on, right? So your staff need to be trained that every single one goes to the privacy officer. The Ontario Ministry of Health and other third parties, sometimes required. So in the case of like systemic breaches, public health emergencies, kind of depends on the nature of the breach. This is all like a speak with your lawyer kind of situation. Let's go to the next one. So when must you notify the IPC? So we just discussed this, but in more detail, if the breach is part of a pattern of similar breaches. So let's say, you don't have to notify the IPC if you leave a piece of paper on a printer. It happens. People make mistakes. It is what it is, right? But the IPC wants to know if over the course of a 6-month period, this happens like once a week, or once every 2 weeks. If you're seeing a pattern that this is a repeating thing, then they need to know about that, right? And they need to know what your action plan is. So if this is continuing to happen, you need to train your users not to do that, right? So the other thing is if there's any kind of disciplinary action against staff. So if anything is ever bad enough that you're providing any kind of discipline, then you need to be alerting the IPC. In PHIPA, it says significant number of individuals. I don't know what that number is. I don't have any details on it. I asked a few different lawyers. Each one had a completely different answer. So I'm not even going to speculate because if the lawyers aren't on the same page, I'm not going to know. So if the breach involves sensitive health information, so like HIV status, and mental health were both specifically referenced on the IPC site. Those need to be reported. Or any situation where the custodian would reasonably believe that either the combination of various different factors would make it significant, because the wording that they use is significant. So let's jump to the next one. Okay, so how to notify individuals. So in writing, so letters and secure email is what that means. In exceptional cases, you can call like verbally in person, or you can call on the phone or whatever. You can notify that way, but you must document the verbal notification. So the other thing is that in the notification, it must be clear, compassionate, and accessible, which means grade 6 to 8 reading level. That's what their expectation is. The other thing is don't hide the facts, but also don't go out like just saying things willy-nilly. This is why I always say, let your lawyer write it. Any kind of notification going out should always be written by a lawyer, in my opinion. So it exposes you to liability because you're admitting to something, right? All right, So how do you actually notify the IPC? So they have a great website that has a secure form on there. You fill it all out right there. It asks you all the questions. You just follow the step by step by step, and that's it. It's simple. Um, that being said, the part that kind of trips people up is that it needs to be comprehensive. So there are sections where it has like a large text box for you to fill in. That doesn't mean you write 3 words. We fixed it. No. They want to know exactly what you're doing to mitigate this so it doesn't happen again. You need to be explaining in detail your corrective actions. So it's not just enough to say we fixed it, right? If there's a big box, use the big box. If it's a little box, you can use the little box. But basically, however big the box is, that's how much data they're expecting you to give. So as far as colleges, usually it's a formal written notice. So you can do a letter, secure email. Internal leadership, I always recommend email. So when you're reporting a breach, let's say you're a PSW and you noticed a breach and you're reporting it to the privacy officer. Ideally, you should be doing it via email because then there is a paper trail and it's not a CYA for yourself, it's a CYA for everybody because the IPC, if they come in and they say, well, um, when was this alerted to you? And you say, it was alerted to me like 3 hours before we fixed it. So like there was only a breach for about 3 hours. Um, the IPC may say, great, show me the proof that you knew only for 3 hours because we think you knew for 3 weeks. That's not going to be, that's not helpful, right? So if you have an email, it protects everybody. So legal documentation. So this is the part that I think a lot of people get tripped up on is that there is a requirement for a breach log, which is a file, or you can use different software and stuff to report on a log of every single breach. So it can be digital, it can be paper, that documents every single breach, no matter how small. Even if the breach seems minor and does not require an IPC notification, you must still log it. Every log should include the date of the incident, description of the incident, date discovered, what kind of PHI was involved, what notification steps were taken, and what you did to contain and prevent it, right? So as far as how to maintain it, you can use all kinds of different ways. So there is specific software that's called privacy breach tracking software. Um, but you can use something also as simple as like just a SharePoint list or even an Excel file. So there are ways to do this. It doesn't need to be super costly, but it is pretty labor intensive. The other thing is it's really important to keep logs confidential. So the privacy officer, maybe the um, director of care, the administrator, or maybe a couple other key leadership, but that's basically it. In an ideal world, it should be the privacy officer and whoever is helping the privacy officer with privacy-based situations. Update the logs immediately. Don't wait until the investigation is over. So you find out about a breach, you create a log right away that says, this is the breach today on April 22nd, and we're investigating. That's the status of it, right? And then as you're receiving new information from the different parties, because the privacy officer is basically acting as a quarterback, and the IT department's talking to them, the director of support services, director of care, whoever it might be, it's all reporting their different pieces to the privacy officer, and then they are updating the log file. And then once it's ready, then you're good. The other thing that's really important is use a consistent format. So standardized fields, like you've got dates, breach type, whether you did any notifications, what actions you did. And this is kind of where a specific software is quite handy because from a reporting standpoint, you can do very detailed reports, and you can start to see patterns that would require an IPC notification. Um, so then, of course, you've got your annual reporting. So it needs to be done by March 1st. Hopefully, everybody is aware of that and is submitting their annual reports. And that needs to include all of the breaches. That's why you keep your log of every single little tiny breach, because every year you're going to be submitting that. So, tips for managing a breach. So the first step is designate your privacy officer. I'm assuming everybody's done this because it is a requirement. And honestly, I haven't seen an organization that doesn't have one. So I'm assuming that's done. Next thing is having an incident response plan. So you have a plan that details out for all staff. This is what the process is. And I like using flowcharts because I think most people can follow a flowchart. If this, then do this. If this, then do this. And you just follow through. And then it's a lot easier for staff because sometimes when they're worried about things, somebody's getting in trouble or like we're going to be fined or whatever, they're not thinking clearly and they make mistakes. If you give them a flow chart when everybody's thinking clearly, then when they're not thinking clearly, they're fine. So, and then of course, the next step is train your staff to report immediately and go one step beyond that and test your staff. So the reason why I keep talking about the printer thing is because that is an example of a really easy test that you can do. So you create a simulated event to test your staff's reaction. So what you do is you create a patient file that looks like it was a printout from PCC or whatever. And you just change the names and stuff on it. So it's not an actual breach. Change the names, change any of the identifiable information, and then print it off, leave it in the printer, and let's see if somebody reports it, right? And it's really important that when you're doing this testing, that you're logging that as well, and you're saying this is part of our testing process. So April 22nd at 9:15 a.m. printed it. It's been sitting in the printer. It was reported at April 23rd at 11 a.m. Well, why did that take so long? You know what I mean? So then you need to investigate and figure out that part. So this is all to really help you stay compliant and make sure your staff are understanding that there's nothing wrong with reporting a breach. Doesn't mean you're in trouble. It creates a safe space so that people get comfortable with that reporting mechanism, right? So reminders, it's really important that you're auditing user activity logs right away. So as soon as the breach happens, first thing you're doing, you're grabbing user activity logs. You're testing your backups to make sure that your backups are clean. You're making sure that the device that was lost, let's say, in the situation of a lost device, is encrypted, right? And you're reviewing the access control and authentication settings. So, Will loses his laptop, and we need to now check. Okay, let's check Will's account. Let's see if there's anything wonky going on there. Let's check what he had access to recently, because then that file might exist on his computer, and that's a good indicator of what might have been breached. So that's kind of the process that you take, and that's part of your incident response plan. So next step, prevention. Prevention is key. So it's extremely important because it reduces the risk so much. the the training, technical controls, and all the governance that exist in IT that makes people hate their IT guys. This all exists for a reason. Like we follow these standards because they're extremely important. So, phishing tests are a great way of just setting something up automatically that's going to be testing your users and making sure that they're keeping that regular state of paranoia, I call it. Because it's not paranoia if someone's actually out to get you. So um, I always recommend mandatory privacy training, provide cybersecurity training like password management, recognizes phishing, secure device use. So like locking your computer when you walk away, protecting resident data, and have role specific ones. So high risk staff, right? They should have additional training. So a little bit outside of PIPA, but like your finance department should have very specific training to do with um, the scams where they're like, hey, I need to change my payroll information. We should probably verify who that person is and speak to the person in person first before you make any payroll changes, right? But that's a good example of a role specific training. Um, so the next thing is phishing tests. So, like I say, you're just going to be sending out a simulated phishing test, try and get people to click the links, and the users who do click the links get additional training. That's the important part. And then the other thing that's nice is that most of these services that are out there, they allow you to gamify the results. So like you get award certificates for strong performers, and then you get scores. So like the one that Brock IT uses, everybody gets a secure score, it's called. And we find that when we set it up for clients, within the first few months, there becomes a competition to see who can get the best. So that's a good example. Access controls, again, least privilege. There's no reason that somebody that only works on the first floor needs access to resident data that's on the second or third floor, right? You only need access to the first floor residents, so you should only have access to the first floor residents, and you should go that way. On the IT side, you're regularly auditing your Active Directory groups, and you're looking at your EMR user permissions and what folder access rights are out there, and remove access immediately for terminated staff. That's extremely important. And I like to do those kinds of reviews quarterly or at least twice a year. So, and then security audits, good idea to have an annual security assessment of the IT systems and anything that's handling PHI. If you can afford it, if it's feasible, penetration testing is a very good idea as well. But that can be quite costly. We're talking a few $1,000s per year for sure. There are some companies out there that charge like $30,000 or $40,000, like accounting firms. Do not recommend that. But anyway, you should be checking your firewall configuration, VPN security, your Wi-Fi systems, email security, um, and then auditing physical security as well. So like your locked storage areas, do you have device theft protection? Like what does that stuff look like? And then your SIEM as well. So that's your security information event management. This is all like IT stuff at this point. Um, so that is basically collecting all the logs from all your different services and systems and connecting them all, and then allows your systems administrator to go through and audit that stuff. It's also really helpful if you like, there are reasonably priced services out there that will monitor your SIEM for you and alert you of potential breaches. So like there's Huntress, there's Microsoft Sentinel, Arctic Wolf, there's like a million out there. So, and then device management. So, disk encryption on all your laptops. So for Windows devices, it's BitLocker. You should have mobile device management for like if people are bringing phones or if you provide phones to your staff, they should all be managed by the MDM, it's called. And that just allows you, if the device is lost, you can remotely wipe it, for example. So, and then it's also really important to keep an accurate asset inventory because you can't know if something's missing if you don't have an inventory, right? So, um, and then of course, last thing would be just automatic patching. So I know the device management one is quite lengthy there, but security patching is incredibly important. It's every couple of days there's a new significant security patch that comes out for one piece of critical software. It seems like we're always chasing it, so that's where it is. All right, that was a lot. So final thoughts, make sure you have quick action, clear process. That will always help. And make sure you're doing your best to protect your residents and your organization. That's it. Open for questions if there's any, but so far it looks like
just some glossy-eyed attendees.
yeah, it's probably going to be phone calls again.
Yeah, yeah, it'd be like 10 minutes after this going, what on earth? Yeah, that it is a lot of information, and it's a lot of it you do rely on your IT department for, but the policies need to be in place, and there needs to be a fairly open discussion within your IT, making sure that these things are in place. So yeah, is there any questions at all? Cool. Yeah.
Looks like it's going to be phone calls again.
Phone calls. Cool. Well, my details are in the slide here. If you have any questions, don't hesitate. We are happy to sit down and chat if you have specific questions and or how it pertains to your organization, because obviously we do have some variation from guests that are here based on their industry and whatnot. So yeah, but if that's everything, I guess we will close it out. So I will follow up with you guys individually, and we will send a copy of the recording and the slideshow with the notes, so you can follow up.
Sorry, well, we also have some sample policies that I'm going to make sure go out to you guys as well, because I know that sometimes writing policies can be a little bit daunting. So at least it gets you a template to work from.
Yeah,
Sweet.
there's some handouts on my side as well. I made a sample breach log so that people can sort of understand what it should look like. So
Beauty. Cool. Well, awesome. Yeah.
all right.
Thanks, Audrey. Cool. So if there's nothing else, thanks for coming. Oh, we got one more. Let's see if it's, oh, it's a thank you. Lovely. Well, thanks for coming. Yeah, and we'll send this out to you guys, and yeah, awesome.
All right, great.
Thank you very much, guys.
Later.
Take care.
Bye.